I want to ask sex questions, if that's okay.
Yeah, no, go ahead.
Does anyone have sex during a treatment? Have you ever heard of this? Does anyone ask you about this? I can't imagine.
I have to confess that we try to not probe too much into that when we should. No, I'm guilty. I'm guilty.
Oh, wait,
I'm
I
very
have
guilty.
to tell you,
I'm
I was
guilty.
in this chemo suite when the topic of merkins came up, and people don't talk about sex. You know what a merkin is? It's like a faux.
It's a
pubic
pubic
hair.
wig.
It's like a
pubic
Bermuda
wig.
Triangle.
Yes,
Yeah, it's
like,
a pubic wig.
It's a pubic wig, and
So I don't understand how pubic wig does not segue into I'm naked in front of someone and I want to.
This isn't a forum where all women are sitting together. They wouldn't come into the office and sit behind closed doors and ask me, "Can I buy a merkin?" That's not something that
This
they.
is why I put my head under a blanket. I'm sleeping. I'm on bed and leave me alone.
Nobody's going to ask me about that in the office, but that's why I love being here. I have the best job in the world. I come here and I meet all these great, really strong women that I admire so much, and so much happens here. So much goes on. There's so much interaction. I learn so much. You wouldn't believe it. I learn so much here, right? But husbands invariably ask me about sex. Can I have sex now? The women never do. Women never
They don't want to have sex.
Well, that's the issue.
It's the last thing on their mind.
That is true. That is true.
And that's a huge issue, the lack of desire, which changes dramatically and very quickly. And husbands, I mean, all partners have an issue with that. I mean, what can we do? What can I do to make it easier and better? I think the most important thing is the message that I would want to leave women with is communicate. Talk to your doctor. Ask questions. I know it's uncomfortable and it's difficult. Talk to other women about what will work for them. There are things you can do to make sex more pleasurable, less painful, and talk to your partner in an honest way.
Jerry Hall, when she was with Mick Jagger, used to encourage oral sex before parties because it would keep Mick Jagger in line. So then maybe there's something to that too.
Whatever works is my opinion. In my opinion,
but
it is work.
You know, you see the same thing though in breast cancer patients. That they go through a very different form of feeling loss of their womanhood.
Yes,
but
in their identity.
But I think it's very different with gynecologic cancers because it's sort of like the gateway to everything.
Yes.
And there's something that's different there.
Definitely.
Now. Yeah. After no matter what kind of, whether it's surgery, radiation, chemotherapy, something different happens.
And hormones.
And hormones, right. And so it makes, it does bring a different take on having sex after going through these treatments.
And we're more comfortable because of all the attention and positive attention that's been paid to survivorship with breast cancer. We still don't talk about that part of the body.
We don't.
We're Puritans, basically,
yes,
despite what we see on TV. We're Puritans. We don't talk about it.
And I have to say it's on both ends. It's from the doctor's end and it's from the patient's end. And there's somewhere that we have to sort of educate both sides as to how to deal with these problems because they're real problems and they're very significant problems.
And it goes back to a woman wanting to know and a partner wanting to know that their other couples are going through the same thing.
Right. Exactly.
This is not unique to them. That's hugely important.
Well, this is a whole topic, a big topic, and one that I think we need to spend a whole session on. And with your help, maybe we can bring in someone who actually deals with the patients from that end, from a therapy end of it, because I think that would be something that would be very valuable.
I have a list of questions that some patients ask, and we ask you to write in also SuiteTalk@lovelifeskincare.com if you have any questions relating to sex and relationships that we can at least search for resources that we can help answer those questions and just have the topic of discussion up. And I hear about hormone therapies and cuts and little minor abrasions, vaginal cuts and abrasions, and dryness and lack of desire and
fear that you're going to make something not right.
Exactly.
Yes, that's a big issue. But I think if listeners have any questions specifically that they'd like to write in about, we'd be happy to compile all these questions and then we'll get an expert in and we could delve into it a little bit more. I think that'll be very, very helpful.
really thank you, Arden. This has been
This
amazing.
was great, Arden. Thank you so much.
Again,
Happy to be
it's
here.
Woman to Woman, and it's up at Mount Sinai in New York City, and just an amazing organization, and really not enough of them going around the country. I
Well, we're
understand.
hoping to expand to other hospitals, so
That would be good. I
think
think
it's a great service.
It's a very, very good service.
Is there any way that they can get in touch, or is there a
You
website?
can call me, there's a website through Mount Sinai, or you can Google Woman to Woman. You can also call me at 212-241-3793. We are right now only see patients through Mount Sinai, but we certainly are flexible. If you need to talk to someone, we're here.
Thank you for joining us, and thank you
Thank
very
you.
much.
Thank you, Arden.
Right
This was
into
great.
us.
Thank
Thank
you.
you.
SuiteTalk, lovelifeskincare.com.
Bye.
Bye.